Good morning. This is our scheduled Saturday morning yoga therapy class. Today I'm also teaching a course on yoga teachers training for National Yoga Academy of Virginia Beach. All of our students have joined. They're getting certified as a yoga teacher, but one of the topic is yoga therapy. So today is going to be the whole day. We start 9 o'clock in the morning. We already have an introduction. What is yoga therapy? We'll have a practice of yoga therapy. Then for the students, we'll have a little break, and then from 12 until 4:30 to 5 o'clock, we have a class through the Zoom with a little lunch break and discussing the yogic concept of digestion. Now for the students, what is more important? They were going to be yoga teacher. So what is their interest to learn about yoga therapy? The most important reason is if they finish the yoga teachers training program and they become a yoga teacher and work in any setup. It could be yoga studio, it could be in a healthcare setup. Almost 75 to 80% of the new people who are coming to that setup will be coming with a chronic diseases to receive yoga as a therapy. Why? Because the word is out. Word is out. There is enough documentation. Like for our healthcare providers, we look at the National Library, and their search engine is called a PubMed. And if in a PubMed, if you put today a topic like yoga therapy, you'll get about over 5,000 articles. Interestingly, they separate meditation, but as you know, meditation is the seventh limb of yoga. But if you put a meditation, you'll get another 7,000 articles. So we'll say about 12,000 articles will come up in an established medical journal. These are not throwaway journals, established medical journals. If you go to NIH website for the research or for the funding, you'll see yoga therapy. If you put a funding, you will get over 450 or close to 500 studies being funded. And same way as meditation. So 800 to 1,000 studies being funded by NIH. And this is a part of our called integrative medicine. Integrative medicine is an integration of philosophy of yoga therapy with the science of Western medicine. Integrative medicine is being just starting maybe about 15-20 years back. About 15 years back, maybe about 3 or 4 medical schools in the United States had a department of integrative medicine. Today, probably about 100 out of 140 medical schools has a department of integrative medicine. 65 of them has a fellowship program, 25 of them has a full fellowship leading to the board certification. In 2014, American board did a separate board for the American Board of Integrative Medicine. Now the physicians are getting certified in integrative medicine. And if you know my book, which I'm going to show it to all the students. In fact, all the students got a copy of my book because this is almost like a textbook for yoga therapy. And if you see the name, it's called Yoga Therapy, Ayurveda and Western Medicine, a Healthy Convergence. And you see the picture of Albert Einstein, I call it Tagore, and it's called when a scientist meets a philosopher. So first definition is, what is yoga therapy? How do you define? But before that, how do you define about yoga? For yoga teacher, the people will come and ask, what is yoga? Yoga is an anglicized word derived from the Sanskrit word called yog, which means union. It's a union of your body, mind and spirit. It's a philosophy. The philosophy is called Yoga Sutra of Patanjali. These are small aphorisms called sutras. It used to be an oral tradition from teachers to the students, and Patanjali is the first person who wrote it down. 196 sutras, of which 193 of them are to control your mind. The practice is called Patanjali Ashtanga Yoga. Ashtanga means 8 limbs. First is called Yam, which is a social restraint. Niyam is a personal restraint. Asana is alignment, external and internal alignment, our body and our parts. Then fourth limb is a pranayama. Pranayama, prana is your life force. Is it a subtle energy which keeps us awake, alert and alive? This life force is carried by your breath. Prana is like electricity and breath is like electric cable. Pranayama is a control and restraint of your prana. Fifth limb is Pratahara. Pratahara means prata means reject, ahar means your input. Input through your 5 senses, so you control your 5 senses. When you can control your 5 senses, you enter into a Khaladharana, which is the focus. You have a focus in your mind, and slowly it gets defocused. If you stay in this limb for a longer period of time, you enter into the 7th limb, which is called meditation. It's dhyan. And then once you're in the meditation for a little longer time, you enter into a state of called samadhi, which is the 8th limb, union of your body, mind and spirit. And this is a stepwise practice to achieve the union of your body, mind and spirit, and the balance of your body, mind and spirit. And yoga, the definition of health is called balance of your body, mind and spirit. And you will see we'll be doing a lot of balancing poses, and we'll show it to you how to do them. Now, yoga therapy is an adaptation of the same practice based on your client or patient's clinical condition. What does it mean? So a person comes with a chronic low back pain. You might start with some physical postures and show the person how to do the physical postures with the breath and how to achieve a relaxation response. Person might come with a respiratory problem, asthma, COPD, pulmonary fibrosis. You may teach them how to relax the physical body and then slowly start with a breathing technique. Or a patient might come with a neuropsychiatric disorder. You might decide to start even with a primary focus, dharana, or primary dhyan, meditation. You may start meditation. So able to determine which tool to use is a yoga therapy. And that's why the training of the yoga therapy is a lot longer than your training of the yoga teacher's training. The way we look at it, yoga teacher's training is like our primary care physician, and yoga therapist are the specialist. For the specialist, you need extra training. Now, what we'll do today, we are going to show it to you that a person is being referred to you or referred to me as a yoga therapist who has no exposure to yoga before. And how do you approach and how do you bring the yoga therapy in their life and a day-to-day practice. For the yogis, the first practice in the morning is able to have a grounding poses, then get up, do a sun salutation, do a little pranayama, and do a little bit more spinal twist, grounding poses, and go back to work. But if you bring that concept to a person with a chronic disease, he or she will leave you right away because they're not going to be able to do it. So how do you do it? So person comes, you let them sit on a chair. Say, I have a chair behind me. I keep it all the time. And then we start a component of relaxation. Remember one thing, that there is a difference between an exercise and a yoga therapy practice. Exercise is a sympathetic overdrive. What is sympathetic overdrive? Our heart rate goes up, blood pressure goes up, respiratory rate goes up, muscle contracts, blood sugar goes high up, and it's basically called a fight or flight response. A car is coming to me or an animal is coming to me, it is our defense, how to protect ourselves. Either I fight, I need the energy, so my sugar goes up, heart rate goes up, or I run away, I fly. Still I need that energy. So it's a sympathetic overdrive, but what happens when the body has a sympathetic overdrive, body creates a parasympathetic activation. That parasympathetic activation is the effect of exercise in our body. So when we're exercising, we are not looking at how high my heart rate goes high up. I'm looking at what is my resting pulse rate. My resting pulse rate lowers down because of that parasympathetic activation. So this is called sympathetic overdrive followed by parasympathetic activation. But yoga practice primarily is a relaxation response, parasympathetic activation without getting into that sympathetic overdrive. Few signs we'll see, like I'm already having a sign, so I'm going to show it to you. Excuse me. Like when you have a sympathetic overdrive, when you have a fearful, your mouth gets dry. Because all of our gastrointestinal tract from mouth up to the anal sphincter is supplied by parasympathetic nerve. Sympathetic is called fight and flight, parasympathetic is called calm and digest. So I have a saliva in my mouth. My mouth is wet. That's what I want to show it to you. I'm sitting down, even talking to you. I'm not drinking any water, my mouth is wet. Why? I'm having a parasympathetic activation, a relaxation response. So when a patient or a client comes to you, you want to initiate a relaxation response. You have a routine or a daily routine of which you start doing a relaxation of the different parts of the body, relaxation of your hands, relaxation of your wrist, your elbows, your shoulder, your neck, your back, your upper part of the chest, then hip, knee, ankle, foot. When you do the relaxation of your body parts, you have a state of called a sthiram sukham asana. Sanskrit word, but sthiram means stillness. Here I am, I'm sitting down in a cross-legged, this is called a sukhasana, but I'm still, I have a stillness. There is no fasciculation, my body is not doing like this. And how do you get it? We'll come to that again. How do you get it? You come in stages. What is the stage? First you start with a no pain. If you can sit down in the ground, it's well and good. If not, get into a chair. So let's go see if I can sit in a chair. And in a chair, and how do you sit down in a chair? So for a relaxation response, when you sit in a chair or when you sit in the ground, first thing you do, you keep your spine straight. You keep your spine straight. I'm looking all over, trying to see. Yeah, it seems pretty good. Okay, your spine straight. Even if you go to the back of the chair, still keep your spine straight. Body will be like a 90-degree angle. If a problem supporting on the feet, you can put a little folded blanket, you can sit down. Spine straight, and then your mind quiets down. The best way the mind quiets down is called your mudras. Mudras are called your health in your hand. As you know, that when I talk, we always talk with our hands. Because whatever I think in my mind, it shows up in my hand. Something good, I said like this. I want something, I do this. I'm listening to somebody, my hand goes like this. This is called Hakini Mudra. Hakini Mudra, these are your Dhanu Mudra, Gyanu Mudra, or your Chin Mudra. So you do a hand mudra. We'll talk about it. We have a big class on hand mudras. The universe is made of 5 elements. So space, air, fire, water, earth. 5 elements are also in my body, 5 elements in my hand. Space is represented in the middle finger, air is in index finger, fire is in the thumb, water in the little finger, and earth, grounding finger. So each touching finger controls your different disease process. This is touching your index finger and thumb, quiets down your mind. Very good for neuropsychiatric disorder, good for overall bringing the calming and cooling for your mind. So start with this. If you bend your index finger down, this is called a Vayu Mudra, very good for controlling your pain. So pain control. The pain is called a Vata disorder. And then you touch in the middle finger and thumb, this is called your Shunya Mudra. This is your improves your hearing. Prithvi Mudra, earth element, Prithvi Mudra. It is very good for your obesity, diabetes. And these are all in my book. So even what I'm saying exactly what I have in my book. So all the students have my book, and you can always go back to the book and refer yourself. This is called your Varun Mudra. Varun Mudra is to improve your bladder function. So most of the good calming, cooling effect of the mind comes when you touch your index finger and thumb. You put it gently over your knees. Then what keeps you pretty active is your 5 senses. So close your eyes. Then when you close your eyes, then you literally assess your body's function. Primarily you're looking for a pain. Any posture which creates pain, you back off. Even if this posture is causing pain, because you have never done a yoga. So sitting down, causing pain, so you back off a little bit, come a little bit. Or if you cannot keep it the first straight, it causes pain, you just bend a little bit. Always listening to your body, but try to keep your spine straight. Then when you do a posture, like when you're grounding, just put it down. If it causes pain, you back off. Next is called your breathing, called effortless breathing. What does it mean? That if you create any imbalance in your physical body, it shows up in your breath. Your breath has to be completely effortless. The lung is like a balloon. It has a 4.5 liter capacity. That capacity is called a vital capacity. We only breathe 0.5 liter. So you have to learn first how to breathe out first. Slowly take a deep breath in and breathe out longer than breathing in. And you will be doing exactly what your body will allow you. Very, very important components. It is not competitive. You always listen to your body. So the components are the spine straight, sitting in a chair or in a ground, or putting yourself against a wall. You can always support your back against a wall and sit down with the spine straight. Hand mudra. This is called a meditation mudra, dhyana mudra, jnana mudra. Eyes closed, bringing your awareness to your breath. Breathe out first. Very easily you can take count of 2 in, 1 and 2 in, count of 4 out. 1 and 2 and a 3 and a 4 out. Generally what happens when you keep on doing it, you develop a habit. In medical terms it's called neuroplasticity. And the muscles of breathing are also called skeletal muscles. That means they can be trained. They can be trained to have a better and better performance. So you will see slowly and slowly you will be able to do count of 3 seconds in, 6 seconds out, 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out. We've been doing it for so long we can do easily 10 seconds in and 20 seconds out. So let's do a practice. If you're sitting in a ground, what you will do, you will start with a called a easy pose, Sukhasana. You put both the feet underneath your knees, cross along the line of your spine, keep your spine straight, touch your index finger and thumb, put it over your knees, be sure there is no pain, there is no discomfort. If you have a pain and discomfort here, you back off. Back off to the position where comfortable and stay in this posture. See, if you stay in the posture, because see, if you push it down, it's always going to come back higher. Stay in the posture, and slowly this thing is going to happen. Then you will see in stages, slowly and slowly, we'll go to a deeper and deeper asanas. So let's practice with the breathing with the eyes closed. Let's start first breathing out, count of 2 in, count of 4 out. Then I will progress. I might go to count of 1, progress, and you find where is your level and you stay at that level. I will even go up to count of 10 in, count of 20 out, just to show to you how easy it is when you practice. Breathe out first. Count of 2 in, count of 4 out. Count of 4 in, count of 8 out. Count of 6 in, count of 12 out. Count of 8 in, count of 16 out. Next, you take both the hands together. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, it's called palming and cupping. If you're wearing your glasses, remove your glasses. Take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your face, massage your ear. Very important. Behind the ear, in front of the ear, auricle of the ear. We call it tragus, even an external auditory canal. The reason is there is a nerve called auricular branch of vagus nerve. A vagus nerve is a mediator of your parasympathetic tone. So you want to initiate parasympathetic tone. If you look at external ear canal, if you do a little bit of just a massaging, you feel a profound level of relaxation. Bring it down, massage your neck, both sides of the neck. There is an organ called carotid sinus. Carotid sinus is also helps with the baroreceptors, and also it helps in your parasympathetic activation, calming and cooling effect of your cardiovascular system, neurological system. Massages in the back and slowly come back again into your hand mudras. So it's a very simple way a person who is starting will be able to do it. Next, you create a vibration. A breath is a state of vibration. You create a vibration. That vibration quiets down your mind. Yoga gave us a sound called Om, which has a component of A, U, Ma. A comes from the lower part of the lung. U comes from the middle part of the lung. Ma comes from the upper part of the lung. When you do that A, U, Ma, you also develop a profound level of relaxation. Another practice is called a Bumble Bee breathing, called Bhramri Pranayama. In a Bhramri Pranayama, you shut down your five senses. Then you breathe out through your nose, breathe in through your nose, breathe out with the sound of a bumblebee. That has a profound relaxing effect in our body and mind. You need to practice on that. So, going back again, the step by step. Sit down in the ground or in the chair with your spine straight, eyes closed, hand mudra, or hand gesture, breathing, exhalation longer than inhalation. Always remember in any yoga practice, exhalation first, because the lung is a balloon. If you inhale, this air is sitting on the top of that dirty air which is already sitting in the lung. So you need to remove the dirty air first, make some room for the fresh oxygen to come in. Always breathe out first. Always breathe through your nostril. Your nose is like your personal air conditioner. It filters your air. If outside air is warm, it cools it down. Outside air is cold, it warms it up. It goes into the side of your nostril called a turbinate, and the air goes directly into your lung. In the process also it secretes nitric oxide from your nasal mucosa. Nitric oxide is a powerful mediator of your parasympathetic tone, the relaxation response. Nasal breathing creates a relaxation response. So if you breathe through your mouth, you don't know where the air has gone. It could go in your stomach, part has gone to the lung, but if you breathe through your nostril, all the air goes to your lung. So let's do the last component, which is a closure of the five senses and creation of vibration, bumble bee breathing. We'll do two times. Let's do it together. Take your index finger, put it in between your eyebrows, call it third eye. Use your three fingers to close your eyes. Use your thumb to close your ear and close your mouth. You have shut down literally your vision, your hearing, your smell, and the taste. You breathe out through your nose first. Take a deep breath in and breathe out with the sound of a bumblebee. Palming and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, take your glasses off, make a cup, put it over your eyes, massage your forehead, massage your eyes, massage your face. So for the whole upper body, with relaxation. I have a DVD called Yoga Therapy for Health and Healing. In that DVD, you have the chapters. Each DVD has a chapter, and my DVD is also in a YouTube. And in each chapter, and you can go into the relaxation, steps of relaxation, and it is so beautifully written it down. If you can, you may not be able to see it that well, but you will see that it's called. Let me read it for you. It's called the Steps of Relaxation. Asanas for relaxation. Relaxation of the small joints of the upper extremities. So, if you can get one of these DVDs, you will be able to see all of them, the step by step. So now, what we find out, a person who comes in, you can start with him very simply, even sitting in a chair or sitting in the ground. If you sit in a chair, first the hands get relaxed when you close it like a baby. This is the baby closes the fist. This is called the baby fist, also called Adhi Mudra, Sanskrit name. Wrist gets relaxed with a called extension. Wrist tightens up with a flexion. Elbows gets relaxed with turning inside, called internal rotation. Outside one causes pain, like I call it tennis elbow. Shoulder gets more pain with what I call abduction, when you raise the shoulder high up. But adduction, coming down, shoulder causes a little bit of relaxation. It is called external rotation, tightness of your shoulder. And called internal rotation, relaxes your shoulder. Neck is very tight. You do that 4 different movements of the neck, back and forth, side to side, look at the back and rotate your neck. It's a big name, it's called a Brahma Mudra, Sanskrit name, but it's called the 4 stages, your rotation of the neck. All this thing can be achieved with another posture called prayer pose to the back. But you put a hand in the front. If you do a prayer pose to the back, slowly and slowly, I will show it to you. You can do it when sitting in a chair. You can do a prayer pose to the back, then slowly do the neck relaxation with a breathing. Like you breathe in first and breathe out. Okay. Let's do the practice together and see this. In one pose, your whole upper part of the body will get relaxed. Always remember, when you get into any pose, in asana pose, the first muscle contracts to get in. But if you stay in the posture a little longer, with your breath being completely effortless, muscle cannot stay longer contracted too long or start to relax. Before relaxation, it causes fasciculation. It's called stability. finally get a profound relaxation. The stages of asanas. Another very important thing to start with the yoga therapy for a person who has not done is called balancing. See, I was sitting down like this. I will teach the person how to cross the leg other way and sit down. And if you are doing it, you will see you always feel more comfortable in one side than the other side. Why? Because you're lateralized. I'm using right hand, I'm using right foot, I'm using my left brain. I'm not using the part of my right brain at all because I'm clumsy. So always try to use a non-dominant hand. Try to use it. Try to brush your teeth like this. Try to eat food. Use your fork. You'll see when you start brushing your teeth, initially the brush will never come close to your mouth. By the time it comes close to your mouth, you'll see the other hand goes like this. Because your brain knows you brush with your right hand. Also, I'm sitting down here, not that I want to sit down, my brain allows me to sit down. So, doing the balancing on the both sides. So if you're sitting in a chair, what you can do, if you're sitting in a chair, you sit in a chair, your feet is pretty grounded, you can take one foot and put it in over there. If not, even you can put a little stool here, support your feet, but try to move your joints. In yoga therapy says, the body needs movement and mind needs stillness. And stillness comes from the relaxation response. So I'm here for a while. When I'm a little bit uncomfortable, I go back, right? Put it in the other side. So alternate that you will feel that the way you can use your right hand, you'll be able to use your left hand equally. That brings your balance, that brings your health. Also, I'm very comfortable in this posture now, relaxation. I progress. I take my heel to the back. I take my one foot in the top and my knee drops down. If you're practicing with me, try this. This is called your perfect pose, Sidhasa. If the knee doesn't come down, don't worry. If the knee is here, let it be here. You stay in this posture, do your breathing, slowly and slowly it will come down. If you push it down, it will always come back higher. So let me show it to you how to do the prayer pose to the back. Let me turn around so you will see, and you will be able to hold in that posture. Now first, you take both the hands to the back. If you can bring it here initially, good enough. If you can put it together, if you can put it as like a prayer pose, it is better. Then you close your eyes, do your breathing out longer than breathing in, and breathing out, as I said, is a relaxation. Parasympathetic, breathing in is sympathetic. Your spine is straight, you're breathing slowly, and your hand will say to slowly keep on going high up and up and up. More and more you get relaxed, higher and higher it will go higher. And in this posture, my hand, my wrist, my elbow, my shoulder, all of them are relaxed. So after the initial relaxation response, you start with your prayer pose to the back. To open up, even if you open up your chest, the better breathing. The moment you have a better breathing, you'll see your asana practice gets better. Now, I'm comfortable a little bit, so I can progress, and I want to show it to you how to progress. And I take my one foot on the top. This is called half lotus, Ardha Padmasana, half lotus. But if the half lotus causes pain, or this is also called a swastika asana, like a swastika, if it causes pain, you back off. Even if there's a pain here, you can back off here. But start somewhere. If you don't move your joints, don't move your body, you will never achieve that relaxation response, never achieve the therapy for the chronic diseases. When you initiate a relaxation response, your blood sugar comes down, your heart rate comes down, your respiratory rate comes down. We have done it. See, we have this. This is the thing I always show it to people. This is an Apple Watch. When I'm doing it, it's recording. It's recording my EKG, recording my heart rate, recording all my body functions. So you know exactly what we are doing. Sorry. So we know exactly how my body functions. We know the effect of yoga in my body. So here am I. I'm putting my hands to the back as a prayer pose to the back. So I'm guiding you, so taking a long time, but when you practice, it is a very simple practice. Initially I tell you, you practice whatever time you have, slowly and slowly, when you feel better and better, it's almost like addictive. We request you take 1 hour of practice in the morning, 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. It's like a prescription for a patient with chronic diseases like chronic low back pain, all the joints pain, knee, hips, neck pain, diabetes, hypertension, heart disease, high cholesterol, gastrointestinal problems. These are all being corrected with 1 hour of yoga therapy practice. Now you will do 4 postures of the neck, and I always like to do it with my eyes closed. When my eyes are closed, I clearly see my body, which is called a subtle body. Gross body, subtle body. Subtle body is the body of your mind. Then another we call a causal body. Causal body is the body of your spirit. We have 3 bodies, we have 5 layers called koshas and 7 chakras. We need to balance all of them. So I will do the neck movement with the breathing. The way I do it, I breathe in first, drop my neck to the back, and in breathing out, I create a vibration. On breathing out, I create the vibration of the Bumble Bee. So let me show it to you. I do all the 4 postures, and you will have a profound level of relaxation. And at that point, you will see your breathing completely effortless. You'll be able to breathe in 6 seconds in, even 12 seconds out. Slower and slower your breathing, longer and longer your longevity. Longer your exhalation, longer your longevity. As simple as it is. In animal world, animal who has a slower breathing rate, they live longer. Higher breathing rate, they live less. So breathe out first. My eyes are closed. Breathe in, slowly drop your neck to the back. Breathe out with a sound of a bumblebee. What you have noticed, when you put your neck in the front, there should not be any pain. If you feel any pain, you slowly back off. Then you have effortless breathing. When you're breathing, the breathing should be completely effortless. If you have any effort in breathing, that means you are creating a imbalance in your physical body. See, my hand is in the back. I'm already feeling relaxed. I can push my hand a little higher up again. I can see the stages are coming. Relaxation is setting in. One more time. Breathe out first. Breathe in. Put your neck to the back. Just practice with me if you're doing with me. Breathe out with the sound of a bumblebee. Do side to side bending on both sides. Same breathing technique. Breathe out first. Take a deep breath in. Third, you look all the way to the back without turning your shoulder on both sides. Same breathing technique. Breathe out first. Take a deep breath in. Finally, rotate your neck with the same breathing technique. First to the left, to the back, to the right, then right to the back to the left. Drop your head down. Breathe out first. Take a deep breath in. Wonderful practice. This is the beginning. You've relaxed your whole body, and that's what yoga therapy is. Yoga therapy says, okay, one more thing, since I feel a profound level of relaxation, I'm changing my foot now. I take my other foot on the towel, and you are looking at how simply we're progressing. We call yoga therapy is the art of transformation. It transforms a person with a disease, a patient, into a healthy person, and then into your person who's practicing yoga, called yogi and yoginis. Called art of transformation. It's very, very important. And you always practice this. This is a daily practice. This morning I'll be doing mostly asana practice, and in the afternoon for the students I will show a breathing pranayama and the meditation. For the rest of the people who are in my class regularly, you have seen the pranayama practice. In fact, yesterday I did another pranayama practice. And I'll show it to you. Now, how to relax? See, in this posture, I'm relaxing my wrist. Now, look at how simple it is. I'm so relaxed, I can take my other foot, bring it up, I can sit down. This is called your Lotus Pose. So I could get into the Lotus Pose first, but I did not. Why? I went in stages. And these are the stages your patient, you're going to bring your patient in stages. It will take some time. Remember one thing, yoga therapy is not that it's a one consultation. You will have one consultation, then the person will keep on coming to you, and if you do a class like me, which is like a once a week in Saturday, then I tell them, please practice at home. It's a daily practice. You have chronic disease, you take a daily medication. You take a medication for your diabetes, for your heart disease, for your pulmonary problem. You take a daily medication. So, instead of daily medication, do a daily practice of yoga therapy. And we have a tremendous amount of experience now. It causes a proper control of your chronic diseases, prevents progression of the chronic diseases. Sometimes it causes complete reversal of the chronic diseases. It gives it better quality of life, and it reduces pharmaceutical support. So I'm so comfortable sitting here. Then one another was called the Yoga Mudra, like trying to put your body in the front as a relaxation. It may not happen initially, it may take some time, but when it comes, it is a profound relaxation. Plus, it causes your spinal flexibility. In yoga therapy it says, you are as young as your spine. Flexibility of the spine is a health, rigidity of the spine is a disease. See? It's a disease when you spell D-I-S space E-A-S-E. You hold your left hand to the back, keep your spine straight. The way to keep your spine straight is look straight. Always do it with effortless breathing. People always ask me, when do you breathe in, when do you breathe out? Yes, there is a technique. Before a muscle contracts, you breathe in. When the muscle contracts, breathe out, because the oxygen is here, muscle needs oxygen. But normally, you want to breathe in and out, breathing out longer than breathe in. So breathing out first, and as I say, I always try to do it with my eyes closed, which brings a better relaxation. I'm breathing out first, taking a deep breath in, slowly dropping my body down. I'm listening to my body's signal. There is no pain, I keep on coming down. My breath is effortless, I keep coming down. If I have a pain in this posture, I back off. I back off, but I stay in the posture. How long? Between 5 to 10 breaths. If you can stay in a posture between 5 to 10 breaths, you progress very rapidly. My breath is good, breath is effortless. How do you know breath is effortless? You can talk, you can even sing. You can do every other work with your breath being effortless. If your breath has an effort, you won't be able to do any functional asanas. So if you can come all the way down, of your head touches in the ground, you stay here between 5 to 10 breathing cycle, and the breathing is breathing out longer than breathing in. As simply as count of 2 in, count of 4 out, or count of 4 in, count of 8 out. And see the posture? I'm talking, I'm breathing. When my eyes are closed, I'm breathing, I bring a profound level of relaxation. Wonderful practice. In fact, for people who are advanced practitioner, you will see, by the time you can come up to this stage, you will feel a level of lightness. You feel like you are levitating. This is called your lifting asana, called Tulasana. Tula means lift. Another was called a Kukutasana. There's a name, but let's just show it to you one. I'm putting my hands. I'm putting my hands on both sides. I just simply push my hand down, my whole body goes high up. Body goes high up, body stays high up. I don't feel the effect of the weight of my body. So I'm talking, I'm breathing. That's a state you need to come in. By the time you need to come this state, you are essentially a disease-free. So now look at that. You have relaxed your whole upper part. Relax your hands, relax your wrist, your shoulder, your neck, your whole upper part, back. Many times you can do the shoulder also with a little called shoulder rotation. You can put your hand in the shoulder, bring your elbows together, and then again listen to your pain. If it hurts, back off. Find the place where you are comfortable and do the breathing. Breathe out first. Take a deep breath in. Slowly rotate your shoulder. Shoulder is called ball and socket joint. The more and more you do shoulder, better and better. Shoulder has one called a rotator cuff tear. Rotator cuff tear, do the breathing. Breathe in the middle, breathe out. Rotator cuff tear is not taken properly, it's called a frozen shoulder. Then the opposite side, breathe in to the opposite side, to the opposite rotation. When you do the breathing and the rotation, do it with your eyes closed. I do it every single day. It's a wonderful practice. Doesn't take much time when you start doing it in the morning with the eyes closed and going step by step. You can also pull your hand behind your head. Very nice. Hold your wrist, breathe out first, take a deep breath in, slowly pull your hand down behind your head. Same breathing cycle. Do not stop and you hold any breath. Breathe in here, breathe out, pull it down, and the same breathing cycle, come back in the middle. Breathe in, breathe out. Breathe in, breathe out. Let's look for the lower extremities. What you can do for the lower extremities. And you will be able to do same thing even in the chair. See the forward bend we did, if sitting in a chair, you'll be able to do it the forward bend from the chair. In the foot, what you do, you sit down with your called Dandasana. Let's see if I properly move the chair. Hands on the side, spine straight. So separate your toes. When you separate your toes, toe gets relaxed. Breathe in, breathe out. So always remember, when you can separate your fingers like a hand gets relaxed. You know, initially, when hands is not, it's very tight. They relax, so it goes in and out. And you'll see also in the toes. Ankle, very important relax because all the body weight comes to the ankle. So the breathing, breathe in, breathe out. Breathe in, breathe out. Slowly rotate, breathe in. Keep your eyes closed, you'll see with the eyes closed and with the breathing. Breathe in, to the opposite side. Both sides slowly. It's a wonderful practice. Again, spinal flexibility is very important. Remember, yoga therapy say, I'm not interested about the disease you have, I'm interested about the whole person who has the disease. I'm taking care of the whole person. And also I'm taking care of it in stages, in step by step. So instead of me pushing, it's coming to me. You don't go for asanas. Asanas will come to you. How the asanas come to you? Prepare your body and mind with the relaxation response. You'll be able to do every asana. Every challenging asanas, you've got a headstand, you've got to go a peacock pose, Mayurasana. You will be able to do everything when you are doing this basic relaxation technique. Seated forward bend, Paschimottanasana. Take your hands and put it wherever it goes. If you can hold the toes, it's great. And you also can do it sitting in a chair. Keep your spine straight and slowly drop your body down, but keep your breathing effortless. Breathing out longer than breathing in. What you're looking for? Pain. If there is a pain, you back off. If you do it too fast, too rapidly, you can even develop an acute back pain. So always be careful with a seated forward bend. In a seated forward bend, you do not, remember, do not do suddenly and do very rapidly, do very hurriedly. Give your time and let the body sink down on its own. If it even comes here, stay here. See, for us, we are relaxed enough, we can put our hands, we can even clasp our hand. It's okay. Still coming down. Eyes are closed. Breathing out longer than breathing in. Essentially, head comes down. It touches your leg, and you stay here between 5 to 10 breaths. So when you're relaxed enough, what you need to do, be sure you need to get up one step at a time. Use your hand and let the hand guide you. It's a wonderful practice. You can do relaxation of the whole lower part of the body. What you can do, take your one foot, and remember separation of the toes. Take your hands, take your fingers and put it in between. Initially it will be very tight, but slowly and slowly it will relax. And market is full of it. Yoga toes, yoga socks, yoga sandals, yoga shoes, and I have all of them. Somebody gave me all the gifts and I have. Okay, I'll show it to you soon. So here what I do, I take my knee all the way high up. I'm hugging the knee. I breathe out first. Always remember in yoga practice, you breathe out first. Take a deep breath in. Slowly let the knee go all the way down. It will go down on its own. If it is not going down here, stay here. What will happen if you push it down? It will be like this. Knee is called site of fear, and hip is called site of emotion. You know, when you're afraid, what happens? The knees start shaking. When I first gave a talk in front of a big audience, what happened? I had a shaking on my knees. But slowly and slowly it goes away. Stress is the fear of unknown. Balance it. Always balance it to the opposite side. Remember, yoga is a balance. yoga therapy practice balance. The left hand is going in between the toes. See how easily it goes? In fact, ankle, you can relax your ankle. You can sit down and do it. And you can do this all the time. 24/7 practice. Bring the knee high up. Breathe out first. Take a deep breath in. My eyes are closed. And slowly goes down. So stress is a fear of unknown. I have a fear. If I go out, I don't know what will happen to me. Am I going to get COVID-19? That fear is a stress. Stress creates a hormone called cortisol. That cortisol creates your truncal obesity, or mental fat. Glucose converts into fat with the cortisol. That omental fat then starts secreting inflammatory molecule or pro-inflammatory molecule, which creates a diabetes, hypertension, heart disease. It's called metabolic syndrome. There is no risk factor for heart disease anymore. I have a heart disease today, tomorrow I'll have a diabetes. Or today I have a diabetes, tomorrow I'll have a hypertension. Today I have a hypertension, tomorrow I'll have a heart disease. As simple as it is. HIP is a sign of emotion. Emotion-related disorder. All the neuropsychiatric disorder, emotion-related. Even our blood pressure, high blood pressure related to emotion. This is called your Baddha Konasana, closed angle pose. You put your feet together and slowly you bring close to you. If you can bring close to you, clasp your hand, and slowly see, this is also called butterfly, Asana. You can slowly keep your spine straight, eyes closed. In a short time, you'll see both the knees are coming down. Initially, I can see I'm not touching the ground, but within a few movements, my knees are almost touching the ground. I'm breathing effortlessly, breathing out longer than breathing in. Hip pain will go away, knee pain will go away. Remember one thing, all the joint problem we have, the pain comes not from the bones, not from the cartilage. People say, oh, my cartilage is all broken down, all the covering is gone, I'm in pain. No, when your bone cartilage breaks down, when the body tries to splint, it tightens up the ligaments, it tightens up your muscles. So grounding poses, it's very important, grounding poses. Yoga is all made for grounding. It's called your thunderbolt, Vajrasana, able to sit down on a hill. So the way to start it, you can first sit down on your heel. Keep your spine straight. This is asana, is so grounding, so relaxing, and it creates again a parasympathetic activation. Parasympathetic, that is called calm and digest. This is one asana we said you can do in your full stomach. After a meal, you do it. Slowly, you're able to sit down on your heel. If you have any issue on that, what you can do, you can take a little bit of a small pillow or a folded towel or a folded blanket. Many a time folded blanket is not better, because a folded blanket, you can put it here and slowly can come down. If you have a problem with underneath, you also can put it underneath your ankle joint and sit down. This is called thunderbolt or Vajrasana. Very relaxing. It helps in your digestion because parasympathetic is called calm and digest. Next one is very good for your trunk and obesity, diabetes, all the chronic diseases. It's called your frog pose, Kumukasana. Use your hand like a baby fist, the way the baby closes, thumb inside and close. Put it at the level of your belly button. You breathe out first. Take a deep breath in. Slowly breathe out and see if you can come down. How far you can come down. Come down and listen to your body's signal. What was your body's signal? No pain. Effortless breathing. Come down all the way. Your head comes down on the ground. Stay in the ground. And you're breathing out longer than breathing in. In normal practice, you do between 5 to 10 breaths. I'm showing you the technique so you understand. Remember, people calls me and tells me too many things to remember, too many things to look at. This is all being recorded. This is all being recorded in your Facebook Live, and then it gets uploaded in the YouTube. You go to my YouTube channel, Dilip Sarkar Yoga, and all will be there. These are all in my book, all in my DVDs, and I always try to share the same asanas, same pranayamas. I do a pick and choose for different diseases, but I do not introduce anything new, because I want you to practice the same asanas, same pranayamas, different sequences for different diseases. So that is the adaptation. That is adaptation of yoga therapy. So comfortably sitting in a thunderbolt pose. It's a profound relaxation. From here you can do what is called your rabbit pose or a moon pose, Shashankasana, Sanskrit name. I know your students, you're just starting, so you may not be very comfortable with the Sanskrit name. In fact, Amanda already told me that go very slowly with the Sanskrit name. I'm not pushing you to the Sanskrit name. I'm always telling you the English name. But if you understand the Sanskrit name, remember, there is a lot of lost in translation. If you understand the Sanskrit name, you will understand that asana so well that you will be able to practice it. So rabbit runs around, slows down. So take the hand all the way high up, push it all the way down as far as it goes. Take the elbows on the ground, and again remember breathing out first, breathing in, and slowly drop your head down, touch your head to the ground, and stay here. How long? At least 5 to 10 breaths. And when you get up again, be sure you walk on your hand and slowly get up one step at a time. Spinal twist is very important. For the diabetes, these asanas are very good for your diabetes. Diabetes because it ignites your digestive fire. It's called Agni, Jathar Agni. It massages your pancreas. Pancreas is way deep in your abdomen, very close to your spine, the vertebral bodies. So when you do the spinal twist, you literally massage the pancreas. You get more insulin out. Massaging the organ makes the organ more functional. As simple as it is in yoga practice. You'll see any way we can massage your organ. A thyroid, you can do all the massages. You can do a fish pose, You can do your shoulder stand. You can do your camel pose. You can do even your cat pose, or even could do call it pranayama. Tired, so massaging the organ. So let me show you how to do some spinal twist. Let me move the chair a little bit. So I'll come back to the chair to show you more asanas on the chair, because we are all patient. We're doing a yoga therapy at the beginners. Slowly you do, it's called a spinal twist. Sanskrit name is called Bhakrasana. Bhakrasana means you're twisting yourself. So if you're doing with me, practice a step by step. Take your right foot close to your left thigh. Right knee goes a little bit towards your left side. Left arm comes out, it goes outside your right knee. Right hand goes to the back. Left hand's up here, slowly comes down, touches outside the knee. You breathe out first. Take a deep breath in, slowly turn your body away from you. And you will notice at one point, you'll catch your breath. So before you catch your breath, you stay in the posture between 5 to 10 breaths. Effortless breathing and no pain is the art of yoga therapy. Written down in your mind, no pain, effortless breathing, and in stages impossible become possible. You will never have any problem with practicing yoga therapy. Always balance on the other side. This time, left foot comes close to your right thigh. You love it, hugging. It's a baby. You're hugging it. Slowly bringing the baby. Left knee going towards your right side. The right arm comes outside your left knee. Left hand goes to the back. Right hand slowly drops down, goes outside your right knee. Keep your spine straight, look straight. Breathe out first. Take a deep breath in. Look all the way to the back. Again, breath should be effortless. If you're practicing with me and do a little bit more advanced poses, we'll do a called a cow face, Kumukasana. You will see the cow face, your whole body, total body get completely relaxed. And also you pick up sitting down poses, laying down poses, face down, face high up, some standing poses, and go one step at a time. You can do a little bit of further extension of this asana, which is called, in English translation, that is called lost in translation, called half Lord of the Fish pose, called Ardha Matsyendrayanasana, big Sanskrit name. It's a name of a yogi and it comes from there. So you have one knee in the top of another one. This is the beginning of called a cow face. The reason it's called a cow face, if you look at it, it looks like a cow face. The yogis look at the nature, and the nature they gave the names. Right foot comes next to your left knee. Right knee goes towards your left side. Left arm comes outside right knee. Right hand goes to the back. This hand slowly touches your knee, then the ankle, then your foot. Again, breathe out first. Take a deep breath in. Slowly turn your body away from you. 5 to 10 breaths. Half Lord of the Fish Pose. Opposite side, same thing. Now your left knee at the top of the right knee. Left foot up comes outside your right knee. Left knee is slowly coming towards the right side. Right arm goes outside your left knee. Left hand goes to the back. Right hand comes to the knee, ankle, and then at the foot. Breathe out first. Take a deep breath in. Slowly turn your body. Release your hand. This kind of spinal flexibility bring your health back, and that is really a treatment for yoga therapy. And you do your cow face Kumukasana, touching your hands to the back. I'll be showing the other way around so you'll understand what I'm saying, and you will do the balancing of both of them. Now I'm putting my left knee on the top of my right knee. Left hand goes high up. Right hand comes here. I stabilize my right hand. I drop my left hand down. I touch it, hook it. I literally handshake each other. It's a wonderful practice. Now you see the difference. Now I'm doing the opposite side. Now my right knee is in the top of my left knee. Right hand is up here. Left hand goes here. I put my left hand in the middle, stabilize it. My right hand comes down, it touches, it hooks. It's literally handshaking. And you've seen both sides is equal. When you're in imbalance, one side becomes easier than the other side. So these are the practices. And once you do the practices, you do some standing up, but this is one yoga practice which will come to you slowly and slowly. It's a wonderful practice. You will be able to sit down in a call your squatting pose, Malasana. Here, your ankle, your feet, your knee, your hip in the back, everything is relaxed. You put your hands together, separate your fingers. It's a wonderful practice. Put your one elbow inside, other elbow inside. Slowly bring your hand in front. Keep your spine straight. Close your eyes. By the time you do it, nothing will come in your way. From here, if you want to get up, it is called sit, rise, test. Very, very important yoga practice. Able to get up without any effort. sitting down and getting up. Going against the grain of your habit is yoga. So you're comfortable standing like this, so if you can put your feet together. Bring the balance. Health is a balance of your body, mind and spirit. When I fall down in my hand. Also I balance with my eyes. So if you can do balancing pose with the eyes closed, that is a wonderful practice. So for the hands, so let's take the hands away. Hold. Right hand holds your left arm. Left hand holds your right arm. Putting your feet together. See if you can stand on a non-dominant foot. I'm right-handed, right-footed. See if you can stand on my left foot. Keep counting. 10 seconds, 20 seconds, 40 seconds. And close your eyes. If you close your eyes, see if you can stay. If you can close your eyes and stay on one foot, it's literally a healing material. I do it every single day, but still I cannot do it. It's a wonderful practice. If you can do about 20, 30, 40 seconds, is it good enough? Change your hand again. Now use your left hand to hold your right arm, right hand to hold your left arm. And so if you can stand on the other foot. Close your eyes. By the time you can do it, this is your yoga. Because not able to put your body in a pretzel. This is your balancing, like you cross your feet, balancing both sides of your brain. Cross your feet, so if you can sit down crossing your feet, and getting up crossing your feet. Try it. Try it when you're practicing with me. To the opposite side. Sit down. Get higher. Spinal flexibility. Mountain pose. Always keep your spine straight. When you stand up, your ear, your shoulder, your hip, and the ankle in the same line. Clasp your hand, go high up, put it over your head. See if you can stand on your tippy toes. Breathe out first. Deep breath in. Slowly see if you can get your toes and go high up. It's called upward mountain pose. Utthita Tadasana. Very powerful asana for your proper elimination. You can do the same one on the side. Called oblique mountain pose. Breathe out first, take a deep breath in. Slowly go to one side. Go to one side, and then again come back in the middle. And stay in the pose. That is very important. I'm showing it to you, but at home, when you breathe out first, take a deep breath in. When you come down in your posture, even if you keep your eyes closed, keep doing your breathing. Breathing out longer than breathing in, and see how long you can stay in the pose. And longer you stay, you will see your body will be diving it more and more. It's a wonderful practice. West rotation pose. These are all called asanas for your proper elimination, to bring your health back. Separate your hands. Right hand goes over your left shoulder. Left hand goes to your back. Breathe out first. Take a deep breath in. Slowly twist your body away from it. Then bring it back here slowly. Same thing you do. Left hand on the right shoulder, right hand to the back. Breathe out first. Take a deep breath in and slowly twist your body on the right side. Massaging all the contents of your abdomen. Massaging your abdomen is the yoga therapy. Here, all the disease is here. After vital organs, here, stomach, liver, spleen, small intestine, large intestine, uterus, tubes, ovaries, prostate, these are all, we're massaging it. You can do the hands in the front. Breathe out first. Take a deep breath in. Slowly twist your body all the way to the back. Bring it back slowly here. Breathe in. Breathe out. Do with your eyes closed. You will feel a profound level of relaxation. In fact, it is so relaxing. This is called a moving meditation. Separate your feet as much as you can and put your head down. When you put your head down, head below your heart is a wonderful practice. It causes the pressure inside the head goes higher, pressure inside the eyes goes higher, pressure inside this carotid artery goes higher. You cannot breathe, you cannot talk, you cannot perform, but more and more you keep it down, the body's homeostasis comes in. Your pressure inside the brain goes down, pressure inside the eyes goes down, face goes down, and you feel a profound level of relaxation. That is the beginning of your inversion poses. When you do inversion poses, even if your shoulders stand, headstand, it's a profound level of relaxation. It is so relaxing that first you do a supported forward bend. You put your hands on your thigh, slowly support yourself and drop your head down. And wherever you can come down, stay here. But for us, we can keep separating our feet. This is called your split Hanumanasana. You can do all the way or stay here up to the width of the mat. Put your head down. My head is down. I'm in a profound level of relaxation. In fact, I can do all the pranayamas, which we'll do this afternoon. I can do Kapalbhati Pranayama, I can do Bhastrika Pranayama. It's a wonderful practice. Always remember, the way you do the yoga therapy practices, you are in a totally state of relaxation. That means each asana is your savasana. You don't need relaxation of asanas. Standing up, then you do call your sun salutation, then a cooling one called a moon salutation. But sun salutation has the 12 steps, and you do with a breathing. We do with a breathing. So let's say for people who just came in, let's do it sitting in a chair. We call that sun salutation in a chair. And let me show it to you. And all the asanas we have done, you can do in a sitting in a chair. Sitting in a chair. So sun salutation has a 12 asanas, also has a 12 mantras. Mantra, man is the mind, tra is the quieting down. Creates a vibration, quiets down your mind. It has a 12 names of your sun. Then it starts with the breathing called Therapeutic Sun Salutation. First you put your hands together. This is the name, your prayer pose, Pranayama. Then you raise your hands high up. It's called a hand raising pose. Then you put your hand down. I will do it all of them. You'll see, you put your hand down, and when you're doing on the floor, you will do the next is your call. Push your one foot to the back. It's called a horse riding pose. Also Sanchalanasana. And do with your each breathing. If you start with the breathing in, then you'll be breathing out. Then the breathing in, all of your breathing will alternate breath. If you start with breathing in, you'll end up with breathing out. Then it's called a Parvatasana, mountain pose. Then you get down on the floor, it's called your touching the floor, Ashtanga Namaskar. Then you get up into a Cobra Pose, Bhujangasana. Then go back to your mountain pose. Then you go to call a horse riding pose, Asa Sanchalanasana. Feet touching your, hand touching your feet, Padahastasana. Hand raising pose, and in the prayer pose, Pranayama. In the 6th one, it comes back again in the same asanas. From 7th onwards, they repeat the same asanas. So let's see how you can do sitting in a chair. Put your hands here first. So breathe out. Breathe in. Raise your hands all the way high up to the back. Hand raising pose. Breathing out. Hand touching your feet. Slowly put your hand down on the ground. And slowly bring your head close to your. Then first is your horse riding pose, Asta Sanchalanasana. Bring your hands high up, hold your knees, bring it close to you and spread your leg high up. Open your chest and look high up. Breathe in. Breathe out. Bring your feet in front and bring your head towards your knee. This is called your mountain pose, Parvadasana. Slowly get into the flow. It's called Ashtanga Namaskar, like a touching 8 limbs. Slowly put your feet together and bring your hands close to your ground and bring your head in the front as if you are in the ground. This is your breathing in. Breathing out, get into a Cobra Pose. Get into the hand into the back. Slowly open your chest. Look high up. Breathing out. And go back into your mountain pose. On the opposite side, it will be your breathing in. Breathe in, feet comes high up. Head comes down, touching your knee. Breathing out, horse riding pose again. You try to bring your knee in front, your foot goes in front, chest opens up, look high up. Breathing out. Breathing in, go back to your hand touching your feet, Padahastasana, hands on both sides, feet, hands on the ground. Head towards your knee. Then breathing out, hand goes all the way to the back, hand raising pose, and breathing in, hand comes in the front. 12 steps, and you started with the breathing in, ended with breathing out. We always do it in pair with the opposite breathing. Let's try with opposite breathing. This time we will do it without mentioning the names and very silently and very closely. This time we'll be doing breathing in. Breathe out first, breathing in. Breathe out. Breathing in. Breathing 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 out. Wonderful practice in the chair. Let me just show you a few asanas on face down and face high up. You probably know all the asanas. I'll just show you briefly how to do it and then finish our practice. We're not going to do the whole, how to, just to show the technique, how to do that. Like when you're laying down in the ground, that, remember, we're not doing any savasana, not doing any counter poses, because every asana was a very relaxing asana. When you lay down, hope you can see me, yes. Always try to see the chin behind your, below your forehead. Don't be like this. This is very sympathetic. Put it down like this. Keep your feet separated up to width of the mat. Hands on both sides. Palm facing high up. And if you look at a baby, baby does abdominal breathing. Like you put your hand, you'll see with the breathing in, stomach wall will rise high up. Breathing out, stomach wall will go in. Breathe in, breathe out. It's also very relaxing, and this also creates a parasympathetic activation. It also ignites your digestive fire, which is a parasympathetic activation. The first asana you do, try to raise your feet high up. It's called feet raising, and slowly get your body high up. You get it to call it both pose, Lokasana. Very important therapeutic asanas. These are therapeutic asanas. Come down, you do a knee chest. Hold on to your knee. You can even hug. Hug your knees. Bring your head high up. Touch your nose to the knee. Chin goes in front of the knee. You are relaxing out. You can do side to side. You can do wonderful practice. You even can do front and back. All the way to the front, all the way to the back. Do it a little bit more. Take your time. But today, just to demonstrate to you how to do them, I'm showing it to you. But when you do more and more practices, we'll do it better way. Spinal twist. It's called Bhakrasana and a monkey pose. Put your feet together, hands on both sides like a T. Look into your right hand and drop both the knees to the opposite side. And able to stay as if you're breathing the normal breathing. Bring your high up. Look into your left hand. Bring both the knees in the opposite side and looking at the other side. Able to stay in the pose within 5 to 10 breaths. It's all the asanas. You can do a lot of different ways. You can separate your feet, going both sides, swing same, or you can do another very powerful way. You can raise both the feet high up, hands on both sides, look into your left hand, take both the feet, comes down and touches your right hand, and look into your left side. Little advanced, same asana, Bhakrasana. If you're doing it a bit right, you will see the difference. Same way, you do the opposite side and turn your head away from you. These are the asanas you do in sequence laying down. It helps your digestive fire. It helps with your truncal obesity. It helps in your reducing this spare time. Bridge pose, hand touching the back of the hill, raise your body high up as if like a bridge, put your hands underneath, slowly and slowly you'll be able to raise body all the way high up. When you're pretty relaxed, you can raise 1 foot high up, Setuvan Sarvanga Asana, bridge pose, the balancing bridge pose. When you relax, you can do very easy. You can do shoulder stand, you can do plow, even you can do shoulder stand and a lotus on the shoulder stand. But these only comes with the relaxation. Let's see if you can do it. You can go all the way to the back. First of all, you can do it. And there is some steps. You can do step by step. But slowly when you relax, you get high up. Slowly you can go down and get into a plow pose. From here, when you relax, you can do a lotus at the shoulder stand. You put it 1 foot here,
Take the one foot here. Wonderful relaxing asana. Lotus on a shoulder step. Then again, when you come down slowly. You can do this thing, is very nice. Put your knee, drop your feet down, push it, relax yourself. Beautiful laying down asanas. For the laying down asanas, you can do a lot of asanas, how to improve your sleep. Like you sleep like a baby. What you do is also very good for your back pain. You have a hip relaxation. Put your feet together. Bring it up. Let the knees comes down. You will see the baby sleeps like this. Called sleeping closed angle pose. Supta Baddha Konasana. Slowly when you're doing your breathing out longer than breathing in. Then get a little bit of breath holding. Then when you sleep, yogi sleep on the left side. Yogi sleeps on your hand. A fetal position. It's a wonderful practice. When you get up, straighten up your leg. Slowly get up. You do some back bends on laying down. When you face down, you do the back bends. Those are called treatment for your chronic low back pain. You don't do unsupported back bend. They're called supported back bend. So what you do, see, more and more you relax. This is called your actually Shakti Asana, strength. Like you put your face down, hands on the, this is called your Makadasana. You can do one which is called your television viewing pose. This is the way baby children see television. Makadasana. You can bend your feet into breathing. Breathe in, breathe out. You can do a Cobra Pose, very simply. Put your hand one on the top. Slowly get up. See how far you can get up and stay here. It's not how far, how long. How long you stay? Cobra Pose. Same thing, when you find the pose, put your hand, go high up, and able to stay in the pose. Going a little farther is called your Oblique Cobra Pose. Very good for your proper elimination, proper your health. Separate your feet up to the width of the mat. Slowly get high up as a Cobra Pose. Then look all the way over the left shoulder towards your right foot. Same way, go down, go in a Cobra Pose, look over your right shoulder towards your left foot. Tiryak Bhujangasana, Oblique Cobra Pose. Put your hands underneath. So locust, put your feet all the way high up. And it's not how high, how long you can stay. Because we are running out of time, so I'm just showing it to you. A bow pose, Dhanurasana, hold your foot and get up into a bow pose. Another one, very powerful relaxing asana, is called a strengthening asana. In yoga, more and more you relax, better and better you strengthen. Face, turning to the left side. Feet goes high up. Hip at a right angle. Knee at a right angle. Let the whole body completely relax. Stay here. It's almost like a savasana, a corpse pose. Do the opposite side. On the right side, take the feet all the way high up. Hip at right angle, knee at right angle. Keep it here, slowly go high up. I don't know what happened, something happened. I have a problem. Okay, let me show it to you now. I think finally I can see in my other screen. Let's finish with what is your most relaxing asana. Most relaxing asana is your headstand. Now you don't do a headstand. Headstand comes to you. How the headstand comes to you? First, you sit down in your, it's called Bhakrasana. Bhakrasana is the most relaxing asanas. From here you find your stance. This is your stance. In your stance, you put your stance in the front, then you clasp your hand and put your hand down. When you put your hand down, then what you do, you put your head down. First, you feel miserable. You cannot talk, cannot breathe, face is all flushed. Slowly and slowly, your breathing normalizes. Breathing normalizes, get up. Don't do anything, just keep walking. If you keep walking, you will see your body is going to go high up. Body is going to go high up. It is going to go high up. You are talking, you are breathing, you are totally effortless. It's a wonderful practice. By the time you come to here, you come down. So what I'm trying to show you, I have done my practice this morning. So you really don't have to go all the way high up. You go in stages. Slowly and slowly go in stages. Only thing you have a fear. If you fear, you can fall down. If you fear falling down, you see, always in headstand, you always fall down in the front. So when you fall down in the front, what you do this practice, and within a short time, you'll be able to get over with it. The head down, slowly, you just... See, you are in total control. You are not out of control. If you cannot do it, you can go against a wall, do it against a wall, you'll be able to do it very easily. This is an asana practice for yoga therapy, and we have gone through in the step by step excuse me, that it will take some time. So the initial concept is bring a relaxation response, a grounding pose, eyes closed, hand mudras, breathing effortlessly, breathing out longer than breathing in, and closing your five senses, creating a sound of a bumblebee breathing. Relax your whole upper part of the body, in the back, lower part of the body, relaxation response. Able to do some grounding poses, like a thunderbolt pose, do your monkey pose, frog pose, rabbit pose, then sit down, do your therapeutic asanas, like your spinal twist,
then your cow face, able to sit down in your squatting pose, able to get up without a support. Do the balancing pose, standing on one foot with the eyes closed, head below your heart with a spread leg. Do a sun salutation in a standing up or in a chair. Face up, all the asanas to massage your abdomen, called abdominal fire, foot raising, boat pose, knee chest, spinal twist, bridge pose, shoulder stand, plow, lotus on a shoulder stand, face down on your called back bends on a mat. First is called crocodile, Bhakrasana. Then you do your Cobra, Bhujangasana, multiple ways of doing Cobra, Oblique Cobra. Then you do the locust. Then you do a bow pose. Then you do profound relaxing called the strengthening Satyasana. And you do a wonderful relaxing asana called a headstand. Wonderful practice today. We'll come back again Saturday for another class. And for the students, we give you a little break. Then you come back in a Zoom after half an hour break around 12 o'clock, and we'll start the class again. Thank you for joining. See you again on next Saturday.